Hello, everyone, and welcome to today's webinar session. My name is Natalie Richardson, not the one shown on the screen that you can see. I'm a melanoma survivor and managing director at Save Your Skin Foundation. I welcome you to today's webinar presentation titled Innovative Treatment Survivors of Melanoma. Before we get started, there are a few things I would like to mention. All participants in the audience for today's webinar will be in listen-only mode for the duration of the session. There will be a question and answer portion at the end of the presentation. You will see at the right-hand side of your screen an option to type in a question. Please feel free to ask your questions throughout the presentation, and we will do our best to answer them in the last segment. If there are any questions that do not get an immediate answer, we will contact you with a reply and any discussion you wish to have after the webinar. This session is being recorded and it will be available for replay on the Save Your Skin Foundation website starting tomorrow. An email notification will be sent to everyone who registered with a link to the recording. At this time, I would like to introduce to you Kathy Barnard, founder and president of Save Your Skin Foundation. Kathy will introduce our additional valued panelists and will guide the discussion. Thanks again for joining us. We will now begin the presentation. I hand this over to you, Kathy.
Thanks, Nat. Good morning or good afternoon, everyone. As most of you know, May is Melanoma Awareness Month. And I have to say, when Save Your Skin started back in 2006, hosting a webinar with a panel of melanoma patients would have been extremely difficult as survival rates were low and being told we only had 3 to 6 months of life was our norm. But today, thanks to innovative treatments, that's not the case. Survivorship is the new norm for a good number of melanoma patients. Now there is hope for us battling this deadly cancer. So the purpose of this webinar today is to highlight the value of these new treatments. And I don't mean the dollar value. I mean the quality of life value to patients receiving them. So without further ado, I would like to introduce you to a few of my friends and fellow melanoma survivors, and I use that word very loosely because we all call ourselves, I think, something a little different. I will introduce myself as Ned, no evidence of disease. But firstly, I'd like to introduce you to Meloney Edghill. Mel, would you like to take 5 minutes and tell us a little bit about your melanoma story?
I'd love to. Thank you, Kathy. I was diagnosed in April of 2006 with metastatic melanoma. It had begun in a mole on my back and metastasized to form a tumor on the front of my shoulder. It ended up in my liver, my pancreas, my lymph nodes. I was, kind of the worst case scenario at the time. And options were really limited. I was a mother of 2 teenagers and a 5-year-old and not quite 40 yet. And basically my oncologist said I had 6 to 9 months with the traditional type of treatments that were out there. So the options given to me were a pretty ineffective chemo drug or traveling to the States to a research hospital, or entering into a clinical trial with one of these innovative treatments that were coming down the pipe. And for me, it was kind of a no-brainer to choose one of the clinical trial drugs. And so in the summer of 2006, I entered into my first trial where they were comparing a chemo drug to one of these new immunotherapy innovative treatments. And unfortunately, it was a randomized trial, and unfortunately, I received the chemo side of the trial. That drug just made me sicker than I was with the disease, and the disease progressed, and my oncologist just, pulled me out of that trial completely and said, this is not working whatsoever. Let's, try and get you into something else. And so there was a second clinical trial with another immunotherapy drug that they were just testing it in 3 different doses. So no matter what, I was going to get it. Got into that in the fall of 2006. Once I was stable enough again after my body, took a beat down from the chemo drug. And after 3 treatments of that, they started testing me in January of '07, so 3 months later, and the only evidence left that I even had melanoma was the pigment in the mole on my back. Everything else was gone. The lumps were gone. Everything was gone out of my liver and pancreas. It was amazing, and I wasn't sick the whole time. These new treatments that they're coming out with not only are working for a whole bunch of us, but we're still able to live and function at the same time. I didn't lose my hair. I wasn't ill all the time. I didn't drop a whole bunch of weight. I was still able to, eat and do everything that I was able to do before. So I guess I'm just a champion for these new type of drugs, because having experienced the old-fashioned kind too, I just can't say enough about these new immunotherapies and the combinations that they're coming up with in order to give us long survivorship. I don't even consider myself a survivor anymore. I just consider myself, an ordinary, regular me again. I don't even think about the fact that I used to have melanoma 10 years ago or 12 years ago. Back then, we didn't know if I was going to see my 40th birthday. Not only did I see my 40th birthday, I made it to my 25-year high school reunion. I've had my 50th birthday. I've now been around for the birth of both my granddaughters. And that 5-year-old that I had back then, he's graduating high school next year. And back then, I was worried that he wasn't going to remember his mom because I wasn't going to be around long enough. And so now I get to see him graduate. So I don't really know what else to say. Kathy, can you help me out here?
I think you said it all, Mel. Mel and I met. Mel, I'm trying to think when you and I first met. Because, yeah, it's got to be 2000.
It was after my surgery and everything. Yep.
Yeah, because Mel's actually a little bit longer in survivorship even than I am. So, I'm right behind Mel. Mel, thanks. It's too bad, though, yet you have to tell your age every time we have one of these calls. That's probably a good thing.
You know what? I don't mind.
Yeah, I know, right?
I don't mind at all.
I know, right? Okay, well, let's switch gears a little bit, and Nige, why don't you tell us a little bit about your journey, because it's a little bit different from Mel's in the sense that you had ocular melanoma. So tell us a little bit about your journey.
I'm wondering if you can hear me.
We've got you.
Okay. Thanks, Kath. Lovely to hear you, Melanie, and happy memories of Nanaimo.
Yes.
Yes, my melanoma is a little bit different. It's ocular. And so it started in my right eye. And a tumor was found there in June of 2010, which is almost 8 years ago. And with ocular melanoma, it's easy enough to treat the tumor in the eye, either with radiation, which I had, or removing the eye if the tumor is very large. So that worked just fine, but half of the people who have the tumor in the eye go on at some time later, and that time varies enormously, but is typically about 2 years, to metastasize. There's no stage 2 or 3. It goes from stage 1 to stage 4. So just short of 2 years later, March 2012, a whole bunch of tumors were found in my abdomen. So I was in the unlucky half. I started working with the cancer agency and got a very consistent message from them that there was nothing could be done about ocular melanoma metastasis at that time. And I heard through the grapevine of Lionsgate Hospital, and a wonderful doctor there. And I found my way to him, and within a couple of days, he had arranged for me to go over there and to start treatment with immunotherapy. Of course, there was no guarantee that it would help. It didn't have a wonderful record with ocular melanoma in clinical trials, but over time, it did appear to have a positive impact for me. And so a year later, the cancer was continuing to grow. So I decided that I would like to try the treatment again. I'd also had some radiation. And so I had immunotherapy again in the fall of 2013 and got a much stronger response at that time. So it seemed as if, my body was picking up steam in terms of getting the cancer under control. So I had immunotherapy a third time in 2016. And there was just a little bit of active cancer left. And so just last week, I finished a fourth course of immunotherapy, putting me into very strange territory, I think, because people either can't get immunotherapy funded a second time or a following time, or they don't respond. I also had a lot of radiation finishing last week, but I'm feeling really good. Here I am talking to you. And I'm evidence that even if you don't get a wonderful response right away, and some of the people on the panel, of course, had a miraculous response, sometimes there maybe can be a slow build-up. And I'm hoping to do really well. And so here I am, and I'm so happy to be here.
Nigel, can you tell us for you what the side effects were like throughout all of the 4 different courses?
It's been pretty consistent each time. After the first dose, I started getting a skin reaction. And, that tended to start at the extremities, just an incredible amount of itching, followed by the development of a rash. And that continued to increase throughout the course of the treatment, which takes 12 weeks, 4 infusions, 3 weeks apart. And then once the treatment stops, the body starts to recover, the itch recedes, and the rash disappears completely. Sometimes it seems to leave, like a little batch of freckles in a place that I didn't have them before, but I don't worry about things like that. So it's been consistent. If anything, this fourth time, the peak seemed to come after the third infusion. And so it's much better already, even though I've just completed the fourth infusion. There's a lot of fatigue that goes with it, so I find I need to rest a lot, but I'm very happy to do that and give thanks that I'm well enough to need to rest.
And I know you're still doing a lot of running, so you must be able to fit that in between your fatigue naps.
Yes, at the cancer agency here in Victoria, they always comment that I come in my running clothes or in my cycling clothes, and for me it's a mind game. I feel if I show up like that, I'm going to do better. So yesterday, for example, I did an hour of exercise in the morning, and then I went to the gym and was severely punished by my personal trainer for an hour. But then I did come home and lie down.
You know, though, I think those are interesting facts, because for somebody like Melanie and I know, Melanie, you had a chemotherapy. I had a chemotherapy for the full year. That was the only treatment available in 2003. And when, you know, I heard the word fatigue, I thought that meant you went home and had a nap. But with the drug I was on for that full 365 days, fatigue was not a nap. Fatigue was sleeping for 365 days. So what I learned through all of the treatments I had, because, you know, most of us know I had, you know, 3 or 4, the side effects were, when people say fatigue, you know, I thought that meant you just closed your eyes for a minute, but that was not the case on chemotherapy drugs. But I think it's important for people to understand the difference of the side effects from the older chemotherapies to the new and innovative medicines, because I know for the patients that we see on Save Your Skin that are going through these drugs that actually still work, unlike a few of us that are lucky enough to not be working, they're actually working throughout their treatment. So I would ask you, Nigel, if you were still working, if you weren't one of the lucky retirees, would you have been able to work throughout the side effects and the rash, or would it have been intense enough that you could not have worked?
No, I would have been able to do it. And the first couple of times I was still working. And I didn't take, I was teaching at UBC. I didn't take time off at that time.
Okay. Okay, let's move to our third patient and his wife. This is the first time we're really fortunate not to only hear from a patient, but we also get to hear from a caregiver. And most of us know how important that caregiver is to us throughout this journey. So Bob and Yvonne, I'd like you, if you could, to tell us a little bit about your battle with melanoma. And Bob, let's start with you. And then Yvonne, whenever you want to sort of insert what it was like from the caregiver's perspective, the mic is yours.
Okay, can everybody hear me?
We can.
Excellent. Okay, my journey, or our journey, started in the September, June of 2012. We just moved into a new house, and we're working a lot outside, getting the garden right, and I felt what I thought was a mosquito bite on the top of my head. And we live right beside a mosquito creek, so we thought, okay, that's to be expected. So so I got this bite on my head, and it stuck with me for quite some time, and it kept getting bigger and bigger. It looked like a blister, and then it eventually got ulcerated. And it was at that time that we decided, okay, we got to get this looked at. But this was about 4 months later, so I really ignored it for way too long. And then near the end of the year, in 2012, we got it analyzed, and it turned out to be a very deep melanoma right on the top of my head. It's an amelanotic melanoma, so it doesn't normally present the same way as a dark pigment. It just looks like your skin color. So it was an unusual kind of melanoma. So in early January or mid-January, we had a couple of excisions. The first excision wasn't deep enough for the margins to be clear, so a second excision was performed. And then I got in touch with a really good doctor in North Vancouver, who's been helping a lot of us in this area. And he got me on a schedule of getting checked with CT and MRIs. And in May, we found 4 brain metastases, which was in and of itself unusual as well, because melanoma tends to occur in the torso more frequently first, and then move to the brain, whereas mine went right to the brain. before it went anywhere else. And in fact, all throughout my history with melanoma, it's never been anywhere else. It's only ever been in my brain. But the brain's a bad place for it. Melanoma, they say, tends to like being there for some reason. So we needed to deal with this quickly. I was sent to the BC Cancer Agency, where I very rapidly got whole brain radiation. So it had 10 rounds of radiation, and felt pretty bad during that whole process. Needed a number of a specific steroid to reduce swelling, etc., and that didn't make me feel very good either. So we at the end of the whole brain radiation, we met with the oncologist, the radiation oncologist, and managed to actually get a quick glimpse of my charts, and we noted that the chart said that my treatment was palliative. We didn't like that at all. It was, and we were never told that. We only by chance saw that it was considered palliative. Well, of course, that's not good enough. And we asked, okay, so where do we go from here? And they told us that, well, we wait for symptoms. We just wait. That too was not very good for us. We're not prepared to wait. As you know, we need to deal with this quickly. So we went back to our oncologist in North Van, and he referred us to another doctor in Edmonton. We went and saw that doctor, and his suggestion was to follow up the whole brain with gamma knife, which is a targeted stereotactic radiation. Well, we worked with the BC Cancer Agency on getting stereotactic radiation, but in the end we were unable to do it in Vancouver because the policy at the time was that they would only treat a maximum of 3 tumors, brain tumors, in Vancouver, and I happen to have 4. So I was told that I need to seek treatment somewhere else. And we found it in Canada, in Winnipeg. So we, in August of 2013, we flew to Winnipeg and got our gamma knife surgery. Very effective and efficient and fast treatment. It was in one day and out the next, save for the flights getting there and back. Also, there were no side effects from this stereotactic treatment, so that worked out very well for us as well. So following GKS, so that was again in August of 2013. We continued to do scans on a regular basis, and we noticed that the scans indicated that the tumors, the 4 tumors, were shrinking in size and consistently. And this progressed for a full 3.5 years, where there was no side effects, nothing. I was feeling great. It was like I was cured. And I felt that way for, as I say, 3.5 years. And then just in December of 2017, one of the regular MRI scans started to show an increase in size of the tumors. And this kind of shocked us all because we were expecting to be basically clear from GKS. And it's notable that all during this these 4 years of just the 2 types of radiation, there was no chemistry of any kind involved in my treatment. But so we decided that, okay, the first thing we want to do is get another, what am I looking at here? Yeah, we
Just
had
wait until the next scan to see if it was getting bigger again.
Yeah.
Every
So
12 weeks.
yeah, so in
March.
Oh no. Oh, sorry. My apologies. I missed a step here. It was in early 2017 that we noticed that there was an increase in size, and we actually went and got a second GKS treatment in early 2017. Yeah.
The tumors came back.
And then later in December, or between March from the second GKS, we noticed again some continued shrinking of the tumors. And then in December, there was another increase. Sorry about the confusion on that. So after the increase in December, a couple of more follow-ups with MRIs showed a continuing increase, and we're now into 2018. So we had a March MRI, and it showed a very large increase of 2 millimeters from the previous 3 months. So we started to get concerned, and there was some confusion about what we were actually looking at. On one of the specific tumors, the largest, it was now presenting at about 14 millimeters, whereas 3 months prior it was 12. So we decided collectively amongst a number of the doctors and ourselves to get a craniotomy to actually see what's going on. So we got a full craniotomy surgery to remove one of the tumors, and it showed to be that it was all dead tissue. It was radiation necrosis was the term that everyone used. So it was of note, though, and one thing I again missed over is that once we got the second GKS in early 2017, we also started the round of immunotherapy to also try and combat the tumors. So it was a combination of Gamma Knife and the Keytruda immunotherapy that I was on that kind of kept everything at bay throughout all of 2017. And it was, again, we got evidence of increasing tumor size in December of 2017. And we've continued on with the immunotherapy as we weren't really 100% sure of whether it was actually the radiation or whether it was the immunotherapy or even the combination of the two that was helping out the tumor. The analysis of the craniotomy, as I said, was that was all dead tissue. So we're considering the fact that we have the same type of melanoma tumor with the same treatments for the other 3 tumors that are still in my brain. And because it was dead tissue for the largest, we believe that the other 3 tumors are also dead tissue. So at this point, we're leaving them alone, and we're just continuing on with the immunotherapy from this point forward. Right now, my oncologist says I'm in remission. So he indicated that, things are looking good. And because it's never ever presented anywhere else in my body, we think we've got this beat. So it was a challenging journey. It's not over yet. There's more work to do, but I'm feeling great. I never had any symptoms throughout my Gamma knife or my immunotherapy treatments. Not even any itching that Nigel experienced, which is quite common, but mine was completely inert to my body. So the immunotherapy is marvelous, marvelous stuff. I can't speak enough for what it's done for us. And I guess that's my story.
Well, Yvonne, Yvonne, did you want to add anything?
I think we got it all sorted out, sort of the journey and what happened. I think the first shock was, you know, when he was diagnosed, and then when we were given an hour to make the decision to do whole brain, and it was, you know, between December and May, 4 tumors had grown, and so that was sort of our only option. But it did buy us time, and in the end, we think it may have controlled it to some extent, but thanks to Save Your Skin and Kathy, we kept going and kept trying. And if there's one thing that the whole brain bought us time, and in this time period, we've, you know, been able to get the immunotherapies because he's been stable. And so because of all this, you know, Bob is still here today, whereas I was given, you know, 12 weeks off of work for compassionate care leave, and because the doctor didn't think he'd make it past you know, 8 months. So it's all good, and you got to keep going, and we're trying to help others at this time, because Bob's case is very unique in that it's never been in his body, knock on wood, but when he was first diagnosed with it in the brain, we felt that he was treated as written off because it was in his brain, but he was completely healthy, younger than 60, and no, you know, non-smoking, good, healthy patient, and we just had to fight through that. Even that he wasn't looked at as a person, he was looked at as number of tumors are in brain. That was how he was looked at. So thanks to the support of everybody and Save Your Skin, we are able to continue on and hopefully inspire others. And that's about it. The only side effect I can see for Bob is he had some fatigue with his Keytruda.
So firstly, I have to tell you both, you talked, Bob, about your garden at the beginning here, and you two have a magnificent garden. Victoria, Nigel, and Mel, you have Bouchard, and we have the Gerard Gardens in North Vancouver over by Mosquito Creek. I've been there and seen them. They're lovely. But you know what, I think what I got, well, I get a lot from everybody's stories because I can relate to some, I can relate to, you know, not all sometimes. My metastases never went to my brain, so I can't even imagine full brain radiation. I can't. But I think what I get from Bob and Yvonne's story is, and I think most of us on this call would agree, is the importance of that caregiver. And, you know, the caregiver can be a number of things. It can be your spouse or your partner. It can be a family member. It can be a friend. It can even be an advocacy group. And I know, you know, I kind of want to talk about coping and the caregiver and how they were so relevant to all of us. And I can tell you, for me, all of my family members played almost a different roles for me. I had my sister that I called my pit bull, because every time we went into the doctor's office, she would point at the picture of his family and say, you know, we have one of those in our house and my sister's in it, and I want her in the family portrait next year. So, you know, get it together. And, you know, I had, you know, a son that I could talk realistically and scientifically to, you know, I mean, everybody in my life, even people that I didn't know, actually really played a significant role in my journey. And I think that's really important when, you know, when people are newly diagnosed, that they search out their team. And I don't mean just their medical team, because we all know in melanoma how important that is, right? Because we generally have a surgeon, a radiologist, an oncologist, some of us a dermatologist. and how important that team is, but also how important that support network is around us, you know, and how you like to get your support. I know some of us, like the ones you see on your screen or that you're hearing on line here, we usually talk generally quite a bit together. We meet with other patients, all of us. We try to kind of move the needle forward if we can. So let's talk. I know if anybody out there listening on has questions, please feel free to type them in. But let's talk a little bit about coping. Like, and I think for us, because most of us are, you know, quite into the journey. Mel, can you talk a little bit about, you know, how you coped when you were diagnosed, how you coped while you were in treatment, and how you even cope now as a survivor slash curative patient slash NED? Like, you know, how have you coped throughout the entire process?
Yeah, so in the beginning, I would say I was not coping. I sort of cocooned myself. I don't know if my thought process was that I was protecting everybody else around me. Um, I didn't know about you back then. Well, I don't even know if you were fully up and running even back then. And so it was basically my husband and I. And, you know, we just kind of did what we had to do to get through. But there were a lot of really dark days so bad that people would be knocking on my door because they wanted to see if I was okay. And I was hiding in my bedroom. I didn't want to talk to anybody. I didn't want to do anything. I needed the whole world to just stop until I had this all figured out and got through it. And then I would come back out. That was my coping mechanism. And there were not a lot of resources for us.
No, we should remind, you know, the listeners that too, that back in 2003 to 2006, you know, when I was diagnosed, the one thing my GP said to me is don't go home and get on the internet. And of course we all did. And we knew very quickly why we shouldn't have, right? There was absolutely nothing. There was no information. There was no survivors. There was really nothing out there for us, not even a treatment option. All bad news. Nige, how about you? How did you cope throughout the process and still are coping, really? Oh, I think you're on mute, Nige.
I think I'm live now. Am I again?
There you are. Yeah.
Okay. I was following instructions to mute my microphone. That's a difficult question, Kath, and of course you would ask that. At the time of my diagnosis, I had family around me, and that helped enormously. It took me a while to build allies elsewhere, but I did that over time. My marriage suddenly ended in the fall of 2016. Partly cancer related, I think. It's maybe not so easy to live with somebody who has cancer. And so now I live on my own. I am my own advocate. But it's taken me a while to, you know, rebuild. It's taken me a while to reach out to people who can help. And Save Your Skin is one of those organizations that will give you a hand when you really need it. Cancer does change everything, and that's a permanent change. It's very interesting to me to, you know, be talking in a group with people like Kath and Melanie, who are becoming very distant now from the trauma. But from my point of view, I've gotten to a good place where I have to be my own caregiver, and I'm able to do that at the moment. And I'm also able to try and give back to others, because the situation remains pretty dark, really, for ocular melanoma patients across Canada. And Save Your Skin is going to change that over the next little while.
I think I hear a challenge, Natalie. Bob, let's you talk a little bit about coping, and then Yvonne, I want to talk to you a little bit about that too. So Bob, can you tell us how you're coping? Did you have a coping strategy? Is it just one day at a time?
Well, when I first got my diagnosis, I was obviously quite upset. I didn't know how to cope with it. We didn't know anybody that had ever experienced cancer before, or we had no resources of any kind. My wife and I, Yvonne, are both very analytical, and we know that, we wanted to live. We made that decision very early on that we're going to fight this. So we did research. We went to the web and found out all about this. And we networked. Yvonne is especially good at doing that. She loves to chat, and she found somebody that actually knew Kathy personally and said, well, you should talk to her. And Yvonne did that in very short order, and we got to know Kathy, and we got some guidance from her. She actually referred me to the doctor that I went to in North Vancouver, because I wasn't very happy with the BC Cancer's assessment and follow-up procedure. I needed something and someone that was much more proactive and would work the way that we think and work ourselves. So again, to answer your question, Kathy, early on we were pretty upset, but once we met you and our oncologist, I thought he was just fabulous. He had the right approach for us, and I mean, when I came out of my first meeting with him, I was in tears. I was so happy that somebody was going to finally take care of me. From that point forward, I kind of let my core nature kick in. I normally am a fairly optimistic person. I like to live life in a positive way, and once I got some people behind me that were committed to working with me, I felt very much better. So it's a transitionary thing. You have to kind of get over the initial shock and awe of the diagnosis. But you have to fight. You have to get your way through this and turn your mental framework around so that it doesn't make your condition worse.
And you made a really valid point again, and I'll go back to building that team, right? And whether it's building your medical team or your support team, that medical team is so vital. In our journey, right? You need to be comfortable with the doctors you're with. You need to make sure you've got the doctors you need in your corner. And I remember when I needed to find a GP, I actually interviewed a couple because I knew what I needed. I knew I was already in the hands of an incredible couple oncologists, because I have one in Alberta and one in BC, and I was very, very comfortable with them. But I needed to make sure that my GP was almost my sweeper. So, when I had scans done and I knew, I was going to have to wait 2 to 3 weeks for an appointment with an oncologist to get the results, I wanted to make sure I had a GP that could pull them up instantaneously and I could get in to see her within 24 hours, because sometimes the waiting process is what can take you from up here to back down there, right? There's so many hurdles. Now, Yvonne, I do want to talk to you a little bit about this because, you know, for us as melanoma patients, I always described my journey as I was sort of the lead passenger in a roller coaster ride. That's how I always defined it. So, you know, as the passenger or the patient, I could see all the ups and downs that were coming. I could see all the curves, you know, coming in my journey. I knew them. I was really realistic about them. But for me, it was hard with the people that loved me behind, hanging on to me. You know, and you know, if anybody's ridden a roller coaster, those people in those back cars are the ones that get swung. You know, they can't see what's before them, and they really kind of get, you know, kind of swung into this ride and craziness. And you know, how do you cope? And you know, what was important for you in helping, you know, Bob through the journey?
The main thing is stay positive. And Bob said, I want to live, Yvonne. He said, I want to live. And I said, we're going to do everything we can, because that was the first decision. Like, some people seem to give up. And so then after that, like Bob said, we're both very analytical, and I'm sort of business analyst oriented. So I do a lot of research. And so that was probably what saved us, being able to do that. And then the hard times, like when he was recovering from whole brain and food tasted terrible and he just slept all the time, I painted the whole house inside. So that was good. So, and then getting through scans, we decided it was, you know, we'd get really sort of irritable and sort of grouchy, you know, a week or two before a scan result was due or scan was due. And so we ended up starting to realize that this was a pattern and that it was, you know, you don't want to let cancer take over your life. So we decided to try and do little things. You don't have to go away on a big trip, but just go on a day trip or go out for dinner or do some diversionary techniques. And that really works well. And so we've kind of kept on with that. And that's another really great coping mechanism. It can just be, say, hey, we're going to go for a walk, or we're going to go visit our parents for a couple of days, anything. And then it just, the scan becomes a matter of course. And we also decided, you know, just treat each result as it is. And in the end, like this last result was just so shocking. We were like, what? There's nothing there? We were pretty sure the doctors thought the cancer was back and it was growing. And when the results came back from the whole brain craniotomy, it's just wonderful proof that we believe GKS and Keytruda worked well together. And so we have proof, and all the doctors want to know about it as well. So anyhow, so one day at a time, one scan at a time, diversionary techniques, and staying positive, and a good team.
Well, I know we don't have really all that long left, but I want to sort of just touch on a couple things. I want to talk, as you know, melanoma. I used to say for melanoma patients back in 2006, we were at the back of the cancer bus. There weren't very many options for us. Mel and I can contest to that. It was chemotherapy or nothing. But now the melanoma patients are driving the bus. We've got a number of treatments out there, whether it be immuno-oncologies, targeted therapies. They work for some, they don't work for all. But we all know too that there's going to be some challenges getting these drugs approved in Canada, because our healthcare system is quite unique. It's federally approved, and then most of you know it goes out to the provincial levels. And we also know that drugs are really expensive. And I wonder if you can, you know, we know the successes we've all had with these innovative medicines compared to the few of us that have been on some of the older treatments. But, you know, what did any of you have any challenges getting the drug? And I don't mean challenges. I know this, not just challenges, because having to park for treatment, get to treatment, etc., are all costs that contribute to our stress levels. But I mean, did you have any challenges even getting the drug? Mel, I don't know. Did you have any challenges even getting to the treatment that was the one that, you know, has made you, you know, a survivor?
Well, I didn't realize that I did, because, you know, Dr. Smiley in Edmonton at the Cross, he just made everything happen. But apparently it was quite an ordeal to get me into the second trial. And he had to get me in there through compassionate means because there was nothing else that was going to help me. But once I was in, they actually asked me to come back in the trial and kept giving me the same immunotherapy for about 4 years afterwards because my results were so amazing that they wanted to track me and keep a really close eye and see what my results were. And so everything that's come, it's kind of cool. I am the dinosaur. Like, I'm the one that everything is measured on now because I was the last person in that trial. So getting me in there, yes, that was difficult. But once I was in, I'm a lifer.
I'm right behind you, baby. Nige, you've had to re-challenge one of those expensive, innovative medicines. Like, how hard has that been?
Well, when the answer is no from the cancer agency, you've got a big problem because, most of us can't afford to pay for the drug. It's out of reach. And, my bill now would be touching $500,000 if I had to finance it, and I don't have that kind of money. So the first time around, I got it on compassionate access because the clinical trials were just wrapping up, and I got lucky. It had not been approved in Canada, but it was approved shortly after. Second time, I got it from the cancer agency because for them, that was their first opportunity to provide the treatment. Third time, I got a no because there was no evidence that it would work, even though I felt I was the evidence. And I needed help, and I got that help from you, Kath, and from Save Your Skin. The fourth time, I'm hearing very confusing stories, but the fourth time I just asked my oncologist to apply to the cancer agency. I was told the answer would be no, and I said, well, I need to hear the no because then I know what to do. And the answer was immediately yes. So it got confusing. Fourth time, no question. So there you are. It's been tough at times, but it hasn't been tough every time.
Now, Bob, I want to ask you that question too, because since you've gone in for treatment, we do know that there's, we've got a couple of the new PD-1 immuno-oncologies. We do know that the Yervoy that Mel and I got is still an approved drug in British Columbia. And we know that the combination of a PD-1 and the CTLA-4, the Yervoy, is also sitting somewhere in the approval process. Now, when you went in, what did your doctor offer you? Was it, an array of treatments? Did you go through, a number of them and discuss? How did that look for you?
Well, we did actually discuss whether we would be on a singular treatment, on a singular drug, or a combination. But it was basically biology that was the determining factor. My tumor was BRAF positive, but because my tumors only ever presented in the brain and never in the torso, my oncologist felt that it was more prudent to stick with a singular treatment rather than a combination. So that's what we were on and have been on the whole time since early 2017. And there's been no discussion of moving on to anything more than that. And fortunately for us, we came into this treatment plan with Keytruda at a time where it had actually been approved. So there was no financial impact to us to be on this treatment plan. So I don't know, does that answer your question, Kathy?
Yeah, I think I just bring this up now because we are seeing again all the innovative medicines that are coming into the melanoma space. We do know they're expensive. We do know we have limited resources within our healthcare systems across the country. And, you know, for Save Your Skin, especially, that leads us to a little bit of worry because we want to see equal timely access for all Canadians dealing with melanoma. And we're finding it, believe it or not, a little bit harder now in the process than we even did 10 years ago. So, you know, that's always a concern, you know, from the Save Your Skin perspective, is we want to make sure that, you know, that everybody listening, everybody newly diagnosed, you know, gets the same opportunities. And I always say this, that I got. My journey wasn't easy. You know that I had, you know, 1, 2, 3, 4 before I got to my magic bullet. So I'm one of the lucky ones. We don't know which one of the 4 or combination of all 4 was what got me here. But, you know, we want to make sure that, you know, that we find the magic bullet for everyone. So, you know, if, you know, Bob goes on Keytruda and has progression of the disease, you know, that he's able to go to the next treatment. And Nige, same for you and for everybody out there listening. So we've only got a couple minutes left. I just want to close because it is Melanoma Awareness Month. Yes, we do have some innovative medicines now for melanoma, but I want to just stress again that 90% of melanomas come from UV exposure. We'd be remiss to talk about the education and awareness. You know, we need to be very proactive. Most of us know that are in our retirement years that those UV rays are a little bit more intense than they were back in the day. Doesn't take you long to burn. So I would still heed the warning, even for those of us that have been diagnosed with melanoma. And I'm sure the 4 of us on the webinar here today know that. You know, you still need to have that hat on. You need to wear your sunglasses and make sure that they have the UVA, UVB. You need to get your sunscreen on. You need to try to stay out of the sun in those peak hours. Seek the shade when you can. Please be very vigilant in the sun. Also, I think early detection needs to be a message that we focus on still during this month. That, you know, if something looks irregular in your skin, you go get it checked, as did Bob. I think, you know, I always try to tell people that your skin is the largest organ in your body. It is an organ. It's no different than a liver, a lung, a kidney, and a heart. And somebody's always looking at you. You know, I'm looking at Nige right now. I can check to see if he's got anything peculiar happening there. So please be vigilant. If you see something odd, go get it checked, go get it checked, go get it checked. So happy Melanoma Month. I don't know if I should say that. For all our listeners, we didn't have any questions coming in, but if you have questions, please feel free to email us anytime. Thank you to our participants on the panel. Nat, do you want me to send it over to you to close her up?
Sure, that would be great. Thank you. I'd like to also say thank you to all the panelists. It's been very interesting hearing your stories, and I wish you continued success in your survivorship. And to everyone else, thank you for attending today's webinar session. As a reminder, this presentation will be available online at saveyourskin.ca starting tomorrow. If you have any additional questions you think of after, please feel free to send them along to myself or Kathy or info@saveyourskin.ca. Thank you everyone for joining, and this ends the webinar session.
Thanks everyone.
Bye for now.
Bye Bob. Bye Mel.
Bye. Thank you.